Thank you, everyone, for joining us for another Learning Lunch hosted by FormatApproved.com. My name is Brian Johnson. I'm the Senior Director of Online Education with Format Approved, and I'll be your moderator today. We'd like to wish you a happy HIT holiday here from Format Approved. Today's Learning Lunch title is EHR Replacement, What Do I Need to Know? We're joined today by Brad Benson, President and CEO of e-Formatics.com. Brad has extensive experience with EHR replacement and data conversion, and we're pleased to share his expertise with you today. You can read more about his credentials there on your screen as I take care of some quick housekeeping notes. Remember that you can ask questions of our presenter at any time during today's session by entering them into the chat area. In the second half of our presentation, we'll address as many questions as time allows. If we do run out of time, answers to all of those submitted questions will be posted to our website and sent via email link later in the week. Remember that all registered attendees of today's session will receive an email with links to both the slides and the recorded version of this event. So we already got a question about slides. Rest assured that we'll send those out to you after the event. Well, Brad, thank you so much for joining us today. It's a pleasure to have you here.
Oh, pleasure to be here, Brian.
All right, well, let's get right into it. A lot to cover today. Let's start with the sort of basic question here. We hear all the time about so many practices switching EHRs. Why are so many doctors looking to switch EHRs now?
So there was a black book ranking study that came out last year, and it surveyed physicians, and it asked them why they were deciding to change EHRs. And the top 4 reasons that physicians said that they were looking to change EHRs revolved around dissatisfaction with their current EHR, or their current EHR not meeting their needs. So, there are other reasons that physicians look to change EHRs, acquisitions being one of those reasons, or wanting to move over to a meaningful use certified system. But for the most part, the top reasons that physicians are looking to change is due to dissatisfaction.
So they're changing because they're dissatisfied with their old EHR. What are their concerns about switching to another one?
Sure. Yeah, well, when physicians and practices are changing EHRs, it's typically the first time they're doing it. There are groups who have changed more than once, but for right now, most physicians, if they're changing, it's the first time they're doing it. So they've never been through it. They have all kinds of questions around how it's going to work, what's going to happen with all of my data, and am I going to be able to continue to use that data appropriately. So some of the big concerns that we hear a lot is, am I going to be able to bring everything over, into my new EHR, or are things going to be left behind? And is some of that data that sometimes physicians have spent years compiling into their current EHR, they have concerns whether some of that data is going to be lost when they move over to their new EHR. There's concerns around costs. So when they're moving to a new EHR, you obviously have the costs associated with purchasing a new EHR and the implementation of that EHR. But there's also costs associated with converting your data and migrating that data over to the new system or potentially into an archive. They want to make sure that when the data is brought over, that not only is it brought over, but it's brought over in a useful manner, so that when they see the data in the new EHR system, it's brought over appropriately and it's displayed in the places that they expect the data to be displayed within the new system. So a lot of times physicians are concerned that maybe they're not going to be able to find it as easily as they could in their current system. And finally, one of the common concerns we hear is, am I going to have to leave my old EHR system up and running indefinitely, where I'm going to have to continue to pay licensing and maintenance and support costs on that old system? Or is it possible for me to be able to migrate all the data so that I can turn off that system and not have to incur the ongoing cost there? So those are some of the major concerns that we hear around the data migration portion of a EHR switch.
And we could call the last one the zombie EHR problem. Is this EHR going to follow me for the rest of my life? Well, I know we're going to address some of these questions and learn a little bit more about what people can do to alleviate those concerns. So let's move on. What would you advise an organization to consider before deciding to switch EHRs? What should they keep in mind?
Sure. So, when you find an EHR that you like and that you're interested in, and it has all the features that you're looking for, you want to make sure before you actually purchase that new EHR that you're considering that you've thought about the data conversion side of it, and that you have a plan in place before purchasing your new EHR. Imagine, the data portion of the EHR is critical for most practices. And you don't want to be in a position where you've purchased a new EHR and now you realize that you can't migrate the data over into that system and continue to use the data the way you've been using it. So making sure that you've thought about that, what the plan's going to be for your data migration, and you understand how that data is going to be represented in your new system there. So as I mentioned, this is for a lot of practices, this is the first time doing it, and they don't really know what to expect. So getting an EHR conversion company such as e-Formatics involved so that we can help you ask the right questions. It's really important because EHR conversion companies have been through the process hundreds of times, and they've seen the things that can go wrong, and so they can help guide you through so that you can make sure to ask the right questions to the new EHR vendor, such as, am I going to be able to migrate all of my data discretely into your EHR? Am I going to be able to migrate a portion of it discretely and a portion of it perhaps in a summary document or in an archive solution, which I'll talk about both of those in just a minute here. So it's really important, the planning side of it, getting the right people involved, and having an understanding of how your data is going to be represented in your new EHR prior to making that purchase. So those are some key things that I would advise doing before making that purchase.
Brad, when you say that, when you talk about migrating data discretely, what does that mean discretely when you say that?
So that essentially means bringing your data over in a form that can be, let's say you have your allergy list within your allergy section of your current EHR. There's a couple of ways to bring that over. You can bring it over discretely, which means that data is now going to be represented in your allergy section of your new EHR, which is obviously ideal for a lot of reasons there. Any sort of drug interaction checking, allergy reminders, all of that stuff that comes with the current EHR and all that functionality, you're going to be able to utilize that functionality on all of your data, versus doing something like a summary document where if you bring your allergy list or your medication list over as a summary document, you have visibility to it in your new EHR, but you can't query it and you can't utilize the functionality that you had, and you can't report on it. So there's definitely a downside to doing a summary document versus bringing your data over discretely.
Well, that's great lay of the land there to understand the difference. So what are some other things that providers may want to think about when they're looking at EHR data migration?
So a lot of the things that we bring up and make sure that practices are aware of is, that there is an obligation in terms of maintaining that legal record And so you need to make sure that you have a plan and a strategy there for that. So state requirements, require practices to keep that data for anywhere from 7 to 21 years. So you need to take that into consideration. All of your data has to be retained in some form for that period of time. So you want to make sure that the care that you're able to give, you're able to continue that care when you migrate over to a new system without interruption. So whatever your strategy is for your migration to your new system, you want to make sure that accessing all of the old patient information is easy, and it's something they can do with typically a click, to pull up that legacy information. In terms of appropriate planning there, it's data conversion it's oftentimes an afterthought. Practices are really excited about moving to a new EHR that's going to have all of this functionality. But the data conversion side of it is something that really that does require a significant amount of planning and can't be something that you just decide to think about, later in the project or later in the data migration. And then pulling in all of the appropriate parties, as I mentioned before, getting the right people involved. You may need some assistance from your current EHR. You're going to have discussions with your new EHR vendor, and then having somebody like an EHR data conversion company that can do all the coordination there and knows all of the questions for all the parties that are involved there. So really making sure that you get that conversion expertise for your data migration, and like I said, it's for a lot of these organizations who are doing it for the first time, even the larger organizations who have highly skilled technical people, they may not be people who have been through a data migration. So if you're, we've worked with organizations that have tried to do this themselves and realized that it's an extremely complex process, obviously depending upon the option or the solution you go with, but especially the discrete portion can be a complex process. So you want to make sure you're working with people who have done it before, and also so that you're aware of what all of your options are. And I'm going to talk a little bit in a minute here about all the different options that are available. And you really want to have an understanding of how are my options, and what I mean by that is the discrete versus summary documents versus archive. How are all of my options going to impact my overall cost for my migration? And then how are my options going to impact the usability of the data? So it's important, rather than just thinking that, yes, I'll migrate my data, it's important to ask the questions, how am I going to migrate my data to my new EHR?
Well, it's the case with so many projects like this, where if you don't do that planning ahead of time and think through all the complications and the options, there's a greater chance that you'll get stuck with whatever the circumstances give you, and you won't be able to do what you need to be able to do. I have a question for you, Brad, though.
Yeah.
Oh, go ahead.
Go ahead. Yeah, I was just going to say, yeah, I totally agree with that. And so some of the keys that I'll talk about in a little bit here are, making sure that there's an appropriate level of testing and that physicians are involved. You don't want to assume that, just make an assumption that the data is going to end up where they expect it. They need to be involved in the testing process there, so they see the data. They see the data in the system as part of the testing process there, and they start to go through their workflows and all that, and make sure that they really understand how the data is going to be represented in there, so that they can get the best use of that data. Often throughout the project there, changes are made. And they say, well, this note which is attached to this here, it's really difficult for me to get to in the new system. So can we put it here, or can we put it there? instead. And typically those adjustments are something that we're able to do for them, depending upon the EHR flexibility, of course. But so it's definitely important to get them involved so that they can have a good sense of what they're going to get at the end of the day.
Well, that speaks to the question I was going to ask, and I'm sure you see all sorts of things out there working with different practices, but is there kind of an expectation, a false expectation you could call it, from providers that, you know, the data is just going to kind of take care of itself, that when you plug in the new EHR, somehow those two are going to be able to talk and everything will be fine? Or
yeah,
there's some of that?
There is sometimes, yeah. There's definitely, you know, it's sort of the people kind of have the impression that it's really kind of you're just moving data, you know, you're just moving data from one place to another, and true, that is happening, but it's important to be strategic about it and to really understand what's happening there, because every EHR system is a little bit different, you know, and so it contains different data, it stores that data in different ways. So going through the process of really, you know, it really becomes sort of a field-by-field analysis and saying, this is how my allergy is represented in the current EHR, and then doing a chart comparison, you know, and looking at all the data for that particular patient's chart in between the two systems there, and making sure that it accurately reflects the patient's chart, and that you can easily get to all the information that you need to be able to get to.
So you were talking about there being different options for how people migrate their EHR data. Can you tell us more about what those options are?
Yeah. So there's really 6 options that are out there for your data, for a data migration. So, you know, I like to, some of these may seem extremely obvious, but I like to mention them because they are truly options. Maybe they aren't good options, but they are options that will work in some circumstances. So one of those options is just leaving that old EHR up and running. As I mentioned, there's a big downside to that, in that you're going to be paying ongoing licensing and maintenance costs, and you're not going to be able to get that full EMR functionality, such as drug interaction checking and allergy reminders on your data. But it is an option to leave that up and running, and you know, obviously you don't want the physician to have to log into 2 different systems to look at one patient's chart. So most people don't go with that option, but that is something that you can do. The second option is really just manual entry. So going in and seeing who the patients are who are coming in for that particular week, those patients who have appointments that week, and really just hand typing the data from one system into the other as they're seen by the physicians. That's not a very good solution either, in that can sometimes take years to get through all the patients to do that. So the other 4 options are all around automating that process. So the discrete data conversion, which we talked about just a minute ago, and all the benefits that you can receive through that. You know, that is definitely where you're going to see the most benefits and get the most usability of your data, as I mentioned, around reporting, around EMR functionality there, ease of access. You're going to get all those things, but it's also the most complex, in that you are dealing, you know, with, especially if you're dealing with systems that use different coding systems, let's say medicine versus ICD-9 for your problems list. So there's typically a mapping effort that needs to take place there. And so that being the most complex is also the most costly to do that. But many organizations do go that route because of all the value that it provides them. So summary documents, which I mentioned, is really just taking all that data and putting it into a PDF file. So you may have you can either put it all in one big document for a patient, one per patient, which is not very usable because you're now sometimes having to scroll through many pages of information to find the piece of information that you're looking for. But you can also do it in ways where you just create an allergies summary document, a medication summary document, a problem summary document, and bring those over. And the nice thing about that is that you do have, if you do it that way, you do have your legacy data it's stored as documents in your document area, and it's typically pretty easy to access that information. The downside being that you can't report on that data. You can't get the EHR functionality on that data. It's really just kind of view only. And so you're not going to be able to do anything with that data going forward. Another option is the legacy EHR data archive. And this is available through, we have a product called Patient Archive that instead of migrating your data into the target EHR, excuse me one second, I'm going to drink of water. Getting over a cold here.
I think there's a lot of that going around.
Yeah. So instead of putting the data into your target EHR, you can just put it into a legacy EHR data archive. And basically those are accessible from your new EHR, so it'll typically just be like a hyperlink or something like that. That you can then click on within your new EHR, and with a single click pull up all of the old information, all the legacy information. So there's a lot of value in that in terms of simple, easy access to all the legacy data. It's not that difficult to do because you're no longer needing to worry about how is this piece of information going to show up in my new EHR. You're really just taking that data, migrating it into, as it is, into a legacy data archive, and then viewing that information. So you don't have to go through the mapping process and all the extensive testing that you'd have to do with a discrete data conversion.
So that's not discrete data if it's in that legacy EHR. Typically it's not discrete data?
Well, that's a good question. It's discrete in the sense that it remains within tables that can be queried and reported on and used at a later point in time for all of those things. So the distinction there is really where a discrete information is a summary document where you don't have the ability to pull that data out and query it and report on it. When you have it in a legacy data archive, or at least most legacy data archives that will store your data within tables, you'll have that data discretely. So I apologize earlier if I may have caused some confusion by saying that your data does not remain discrete in a legacy archive. It does remain discrete. It's just not within your target system there.
So that must limit, to a significant degree, the use you can make of that data. You can find it if you need to go get it, but the EHR isn't using it in a dynamic way. Is that a safe description?
That's one way to think about it, is instead of the data being stored in the database of the EHR, where everything that an EHR does, looks at that data within its own tables. If it's stored in an archive, just think about it as a completely separate database that's visible from your current EHR, but doesn't, all of the logic and all the allergy reminders and drug interaction checking and all the functionality doesn't apply to that set of data. So the good thing about it is that it's easily accessible. It's easier to migrate that data over there, but like we said, the downside is that you're not going to get that full functionality on it.
That makes sense. So what about hybrid conversion?
Yeah, so that's really a combination of any of these options that are listed here. What we often see organizations do is, and this is the most common conversion that we do, is a hybrid conversion. And what's nice about that is it allows you to have the flexibility, depending upon your needs and depending upon your budget, to pick and choose which of these make sense for you on a module by module basis. So you may say, and this is something we see a lot, where a practice will bring over discretely into their target EMR problems, allergies, and medications so that they can get that full functionality on that data. But then they may take everything else and put it into an archive solution. So they kind of get the best of both worlds there in terms of they get the full functionality on the data that they're looking to get the functionality on, plus they're able to easily migrate all of their other data and store it in a legacy archive solution that can be queried and reported on at a later point in time, and they don't have to go through the complex discrete migration process for each and every piece of data that they have. So that's a really common solution that organizations go with. And like I said, it's really going to depend upon the budget that they have for doing the migration and the needs and the requirements for that migration.
So if people are concerned about the cost of it, what is I guess it'd be the most affordable conversion option?
Yeah. So that's really going to be your legacy EHR data archive. Not only are you saving in terms of how easy the migration is compared to a discrete conversion, you're also saving in being able to turn off your old EHR system. So all those support and maintenance costs, which are going to be going on indefinitely, as you said, sort of the zombie solution there, that's all going to go away because all this data, as long as you can get your data out of the current EHR that you're on, and there's usually several options for that, your legacy archive is going to be your most cost-effective solution. So like I said, a lot of times what organizations will do that are cost-sensitive is, let's bring over the most critical data modules, problems, meds, and allergies, and then which, yes, there's going to be a greater cost associated with bringing those over discretely, but then everything else can go into the legacy archive.
So can you were talking about this mapping for discrete data migration. Can people get everything? Is that a possibility to just get everything loaded into the new system?
It is a possibility, but so the way to kind of think about it is, yes, there may be, if you're dealing with two different coding systems, let's say for problems, and the data doesn't really match up in sort of a one-to-one basis there. There may be some things that are lost, so you want to make sure that if that's going to occur, that your strategy accounts for things like that. So in a situation where maybe it's not a real clean conversion, let's say for your problems list, what you might want to think about doing there is bringing over, discretely the problems list as best you can into the target system, but also putting that data into the archive there, so that if you need to go back and look at that data for any reason, you can see the data as it was in the source system. And so with a hybrid solution, you're going to be able, in some way, to migrate all of your data, assuming that you can get the data out of the source system there. And as I mentioned, most EHRs are on databases where you can easily query the data or dump the data out of the system, but not all. And in some situations, you may have to actually get the source vendor involved to just dump the data in the database out to flat files that can then be worked with. So that's something that you want to, that we look at up front, is say it's one of the first things we look at is how is the data going to be pulled out of this source system, and how much of that data can we get out of there.
Well, that sort of speaks to the flip side of that question. Is some of that data going to be lost?
So, like I said, if you are pulling it, if you're able to get it out of there, then it's not going to be lost because you're going to be able to find some sort of a home from it, either via the discrete conversion, a summary document, or the archive solution. But one thing to think about too is many of the systems are in the cloud, or they may be hosted by in a third-party environment that's not hosted by the vendor, the EHR vendor there. So you want to make sure that if you are in a situation where you're working with a third party and maybe your data is actually stored in an EMR within the same database as other practices. So you want to make sure that you talk to whoever is hosting your data and find out what all the options are for being able to dump that data out of the EHR. In most situations, they are going to be able to do that for you and dump that data. There's almost always some sort of a cost associated with that, but what's really important there is what are your options for being able to get that data out of there.
Is that a special concern with cloud-based EHRs that you need to get the data out because they may not retain it, or what does that whole situation look like?
It really is going to really going to vary by EHR and and the contracts that have been signed in terms of what the EHR is going to do with your data once you leave there. But so that being the case, it's really important to have an understanding. Once you leave there, what are they going to either A, allow you to do, or B, what can they do for you in terms of extracting the data out of there? So really critical to, if you are using a cloud-based system there, to understand how the data, how easily you're going to be able to access that data and pull that data out of there when you do make the switch.
So you talked about what are some of the more affordable options, but how much is it really going to cost in the long run?
So, I went through a lot of those options, and there's obviously a different cost associated with each of those options there. So what you really want to do is get an idea of what the different options are going to cost, and what I suggest and what we typically recommend to people is once you know what those options are, for example, what is a full discrete conversion going to cost? What is a legacy archive going to cost? And once you have those options listed out, then you can kind of go in and say, well, if I do a third of my migration discretely, and then 2/3 of it I do with an archive, you can kind of figure out and get a general sense of what your overall cost is going to be. As I mentioned a little bit ago, discrete conversion is definitely the most expensive, but it definitely provides the most value. And the legacy EHR data archive being the most cost-effective solution, as I mentioned a couple times. I definitely recommend finding the most appropriate solution based on your budget there, and the needs that you have. And by needs there, I mean, do you want to make sure that you can turn off your old EHR system, or is it a requirement to have that data in the physical database of the target system to get all the functionality? So really just having an understanding of those two things is going to help you be able to figure out what's the most appropriate solution and how much that's going to cost.
Well, here it comes back to that whole planning issue that you talked about at the beginning, and I think if providers are not accounting for the fact that there's going to be some costs associated with making that data valuable, continuing to use that data, then they may not factor that cost into the cost of replacing that EHR, and they really should.
Exactly. It's definitely part of the cost of the overall switch there. So it's definitely something that we like to make sure people are aware of. and start asking these questions early on before making the decision to switch, so that you truly do understand what the overall cost of the switch is going to be, and it's not just going to be the price of the new EHR. So that's a great point, Brian.
So how can a provider then be sure that they're going to get the data that they need, that it'll work appropriately in their new EHR?
So as I mentioned earlier, not only starting that planning process early, but getting the physicians involved in the testing. And I won't go over all the reasons for that because I spoke about that at length earlier. But it's really key to do that. You don't want to assume that, like you said, that you're just moving data from here to there and that it's going to show up in the right place. You want to get the users involved, the users of the system, so that they know exactly how it's going to work when they make the switch there. And that we do and advocate others to do is creating test cases for every scenario that you think you may potentially encounter. I mean, if you have a situation, let's say you've got, maybe you have duplicate allergies in your current system, and you want to make sure that when that data moves over that you don't have duplicate entries anymore. A lot of times the inbound interfaces that take your data from a source system and put it in a new system may have the ability there to filter out duplicates. So that you can kind of do some data cleanup as you're performing your migration there. So kind of listing out all the different scenarios that you're likely to encounter and making sure you have a test case there and make sure that all those test cases pass prior to doing your live data migration there. And finally, in order to make sure it's going to come over appropriately, you want to make sure that you've got all of your data. So there needs to be validation reports that are run, in terms of counts of your data beforehand and counts of your data once your data has been migrated over. A lot of systems have, depending upon the way that the data is migrated into the system, most systems are going to use interface engine, which is going to have the ability to handle your errors. So any errors that occur, you're going to be able to work those errors. It may be a mapping issue, or maybe it couldn't find the appropriate patient or whatnot. And you're inevitably going to have some errors when you do your migration. And so you want to make sure that you have the ability to resolve any of those issues, and that you have a way to check and confirm that all your data has been migrated over successfully through the use of running some reports on the migration process.
Well, here we talked about this as a zombie EHR. Here we have a rather aged robot to represent the same thing. It seems crazy to me that people would leave their old EHR up and running, but I'm sure people do it all the time. Tell us about, why that's a bad idea and why people would do that. What are the ins and outs of that one?
So usually, there's a couple of reasons that they would just leave it up and running there. One would be maybe there's not an option there to maybe it's going to be difficult to get your data out of the new system. Maybe there's not a lot of options in terms of getting your data into your target system. Unfortunately, there are a lot of systems out there that is really only going to be able to bring over your demographic information and not much more than that. So, if you don't have a lot of options there in terms of getting your data into your new system, then you may just leave it up and running, and maybe some vendors may be affordable, or it may be cheaper to just leave it up and running. Obviously, a ton of downside to that, but that's why it's important to make sure you understand what you're going to be able to do with your data prior to switching EHRs. But so as I mentioned earlier, in most cases, as long as you can get that data out of there, you're going to be able to do something with it, and you're going to be able to meet all the requirements in terms of retention of the chart, and you're going to be able to turn off that old system and save on licensing and support costs, which can be pretty hefty in many cases. So.
Shouldn't the provider be able to get at least a data archive out of there, even if the EHR is kind of squirrely in some way or another? Can't they get some kind of usable database out of there so that they don't have to keep that thing up and running?
Yeah, a lot of times what will happen is the data will be dumped out into just flat files, So it's going to vary from vendor to vendor, but in most situations you are going to be able to get that data out of that system in some format. But what's important is how usable is that format, and what are you going to have to do with that data once they dump it out to be able to use the data in a way that's meaningful. So, a lot of systems with the push for interoperability now are able to generate CCD documents out of systems, which is really just a summary of the patient's chart there, which is very useful. But not all EHRs have that capability. So sometimes you may just get a dump of tables, and now you have to go in and really load those somewhere else and write your queries appropriately to pull the necessary data that you need out of there. So it's very... Oh, go ahead.
I was just going to say, so it sounds like in some cases, if the data isn't very usable, it might be better to leave it in the EHR because at least then you can search on it. And is that true?
Yeah, you're going to want to weigh the cost there. You're going to want to weigh that and say, well, to take it from this unusable format and put it into, be able to get it into my new EHR, it's going to cost me X. But to leave it in the current EHR and up and running indefinitely, it's going to cost me Y. So making sure that you understand that what all the costs associated with those options are, and that way you can make an appropriate, informed decision based on the feedback that you get from who's ever doing the analysis there.
Well, I just can't help but think of there being an old kind of, say, an ancient apple in the corner or something that people go to access that old EHR. It's covered in cobwebs and...
Yeah, and it happens quite a bit, and there are organizations that do that solution, but it's definitely not something that the physicians prefer. It's a big issue, is having to go to 3 or 4 different systems to find all the data that you're looking for. And one of the things that that's a nice benefit of the archive is you can put multiple systems into that archive. So maybe you have a lab, lab information that you want to put in there, as well as some of the data within your EHR. All of those legacy informations can come together in one archive. And you can also even put financial information in there. So that's a nice feature, in that you can sort of consolidate all of your legacy data, not just from EHRs, but from any healthcare electronic system, and be able to access it all in one place.
Well, we've saved plenty of time for questions and answers. We already have some questions from our audience, but I'd certainly like to encourage all of our other guests, if you have questions for Brad, this is a nice opportunity to get an expert opinion on data conversion and EHR replacement. I just have to say, listening to you, Brad, I thought it was a really interesting presentation. I'm glad we get to continue the discussion here through questions, but it just seems that with the growing importance of structured data, that discrete data, this is only going to become more and more important over time, it seems to me.
Yeah, 100% agree. Why it's important to realize that is, some organizations may say, you know what, we've only been using this EHR for a year or so. There's not a ton of data there, but and maybe you don't want to spend a lot on a discrete conversion in that particular situation. But know that if you go with a summary document solution, all of the information that you've taken and time you've spent to gather that information over the the use of your current EHR, if you put that in a summary document, you're not going to get any further use out of it down the road. So you're not going to be able to do all of your reporting and metrics on that information. So going with an archive route can also be a way to make sure, because your data is stored discretely in tables there, that whatever use and whatever reporting you want to do on that information in the future, or potentially just keep it in the archive and do a discrete migration at a later point in time, that gives you the option to do that. So it's really important to understand that the information is becoming more and more and more important, and so you want to make sure that, if possible, that you maintain the ability to get all the usefulness out of that data.
All right, well, I think that makes a lot of sense. Let's get to some questions from our audience. This is kind of a statement, but also I'd like you to address it. And it regards planning. You talked about how important it is to get practices to plan for data conversion. But, that's difficult to get practices to do sometimes. They're all different, but some practices are a little resistant to planning, whether it's ICD-10 or what have you. Do you have any tips for helping, practices prepare for this process?
I guess starting early is key, right? Because then you're going to have more time. But a lot of times, some of the effort that's involved from the practice, it doesn't have to be extensive throughout the entire process, right? So just pulling them in when necessary to take a look at the data and do the data validation. Not having them do all of the testing and looking at every piece of information, but taking a look at the data once it's in there and really giving it a decent look to make sure it's how they need it. One of the things as well that comes along with the data migration is the mapping process. So there's things that can be done there to sort of minimize the effort that's needed from the actual physicians for that process, such as utilizing companies that can really do that, automate that mapping effectively. And for example, with Health E-Formatics, we have a utility that makes that process a much simpler process to kind of work through the mapping there. So really having and part of what we do in the assessment as we're trying to figure out what's the appropriate strategy is really let the practice know what their level of involvement is going to be, so that they really have an idea going into it. They have an expectation of what basically what to expect in terms of the time that's needed from their side in the process. We feel it's really good to let physicians know up front what their potential effort might be, so that they're not, once they get into it, just that they're having to spend more time than they planned for.
All right. Well, I'm going to advance to the next slide so people can see the link to Health E-Formatics for those who want more information. Look at the URL there, but we're going to continue on with our questions, and we'll talk a little bit more about Health E-Formatics here at the end of our session. We've had a couple questions along these lines, and the question is, you talked about how so many doctors are switching EHRs because they're dissatisfied with their current system. What are some of the reasons you're encountering that doctors are dissatisfied with that old EHR, and what's the sort of calculus of, I'm unhappy with this, but there's a lot of trouble and expense involved with switching. What can you tell us about that?
Mm-hmm. So usually what we see there and what's happening there is a couple of different things. One, where it may be a specialty practice that is using an EHR that was really designed in a more general fashion, so that they're not able to use the EHR in a way that's specific to their specialty. So we definitely see that one quite a bit. In other cases, we'll talk to people who really are dissatisfied with the response time of the current EHR. So when they're having issues with their EHR, they're not able to get them resolved in a timely fashion. That's a very common one, unfortunately, that we hear, and they say we just need to go, we need to know that our voices are going to be heard when we're having problems with our system.
So these are folks who are contacting their vendor and then not getting a response, the response that they expect.
Correct. Yeah, yep. Either because they're having an issue with it, or they need something added. Maybe they need a feature added to it that's critical for them, and they're not able to get the attention that's required for them to be able to use a system the way that they want to use it. So those are probably two of the more common ones that we hear in terms of why they're dissatisfied with their current EHR.
So folks will say that maybe the EHR isn't a good fit for their actual practice, and then there's this other issue you mentioned with...
In terms of support, yeah.
Yeah. All right. Well, let's ask another question. This is an interesting one. A lot of the EHR vendors are very protective of their data formats. We certainly see that. So the comment from the guest is, do you think it's wise to include some kind of prenuptial clause in the purchasing contract? Or how can people deal with this sort of proprietary, almost secretiveness sometimes from the vendors about their data when the providers need to get that data and be able to use it?
Yeah, that's a great point, and physicians seem to be more educated about this and understand the importance of this, especially anyone who's gone through a migration and had issues with it. So it needs to be, it's something that needs to be crystal clear up front, and part of the agreement that if they decide to leave that current EHR, then the EHR needs to ensure that they can deliver the data to the practice there, and deliver all of the data out. So that's something that I think we're going to see more and more that is being pushed for as part of the terms of the contract with the new EHR. That sort of guarantee there that they can get all of their data, that it's their data, that they own the data, and so that it can be delivered and they can and move it to another EHR if they need to.
For folks who...
Great question, though. Great question.
Yeah, I'm sure people run into that issue all the time.
Yep.
For folks who have the capability, can they just export their patient records as CCDs? What are sort of the pros and cons of that approach?
Yeah, so one of the pros of a CCD migration is that a lot of these EHRs you can spit it out, but generate the CCD from the EHR there, and you typically in some sort of an automated fashion you're able to do that, and as part of the push for interoperability, a lot of the EMRs out there are starting to be able to consume CCDs into their system in some form, right? So, but a lot of times what you'll see is if there's a CCD migration, the data may not really end up in the tables that you want them to in the target EHR without some sort of validation from the provider the first time he opens up the chart there and sees, and it says, what do you want to pull in, and this, something may need to be mapped appropriately to get it into the target system there. Whereas if you're doing a discrete conversion, you're not going to have that. So the data is going to flow through because you've already been through all the mapping and everything with your data. So it is truly just going to flow through into the appropriate place in the target system. I guess the con of the CCD route is that it's not going to contain everything.
Yeah, that's what I was going to ask. The CCD doesn't have everything in it, does it?
It does not, and not only does it not have everything, it doesn't, even for a particular module, it may not have all the fields for that particular module. So, you may have 30 fields that you're keeping in your EHR around an allergy, but the CCD may only have 3 or 4 that's pulled over. So so that's important to recognize that CCD is a nice clean way to go. It's a simple way to go if you can generate a CCD and you can import a CCD into your target system there. But you are recognize that you're going to be limited in the amount of data that you're going to be able to bring over using that method.
All right. Well, I think that's.
So I guess one point to that that I'd like to make is what we do a lot of times for that is we may do a CCD migration, let's say for problems, allergies, and meds, but we'll still put that data into an archive so that you can ensure that all of the data that was in the source system that you still have that, and you still have that retained somewhere if you need to take a look at it.
So that would be another example of a hybrid solution.
Yep. Yep.
Well, we're nearly out of time, Brad. I was hoping you could tell us a little bit about Health eFormatics and the sort of services you're able to offer around today's subject, if you could.
Sure. So we specialize in EHR data migration services. So this is a very large part of our business. Probably 80 to 90% of our business is doing these migrations. And so what we do is when we're contacted about an EHR migration, we help the customer, talk them through all of the options that we talked about today. Let them have a good idea of what the costs associated with each of those options are going to be, help them create a strategy for the data migration so that they know what they're going to end up with at the end of the day there. So that's a big part of our business, as well as the archiving side. So we have the patient archive product, which integrates in with a lot of the EHRs that are out there that can hold all of that data, from your current EHR within there. So that is a product that is a Health eFormatics product. That's a nice option for along with our services there. We also, because we know the back end of so many EHR systems that are out there, organizations that are looking to do a lot of reporting on their data, not only of their legacy data, but of their current EHR systems. Maybe their organization is utilizing 3 or 4 different EHR systems. We can write all of the queries to pull that data into a warehouse on a regular basis, so that they can do all of their reporting on that information.
Well, certainly anyone who's looking to replace their EHR and trying to wrap their brains around this data conversion issue, certainly visit healtheformatics.com to learn more about what they can provide. And thank you, Brad, for joining us today. A very informative session.
Excellent. Thanks a lot, Brian. Really appreciate it.
Well, again, look for the follow-up email from Format Approved that will provide the slides and a recorded version of this session, along with written answers to the questions you submitted today. I'd like to thank all of our attendees. Again, look for that email with the follow-up slides and video. Do you need a meaningful use risk analysis for your 2013 attestation? Core Measure 15 requires a risk analysis be completed during the reporting period. So you must complete the required risk analysis before the end of the year, even if you won't attest until 2014. As audits for meaningful use expand, providers report that failure to complete a risk analysis is the leading reason why they fail the audit. Now, as part of a special year-end promotion, Format Approved is offering a $300 discount on the risk analysis. Visit www.formatapproved.com/education/HIPAA-secure/risk analysis. That's a lot, so just look at the URL on your screen or click on it when we send the slides. And be sure to use the discount code MUSPECIAL to receive a $300 discount off that risk analysis. Time is running out, so act quickly. Visit formatapproved.com to learn more about our upcoming Learning Lunches. The Learning Lunch button will take you to our upcoming webinars where you can learn more about them and register. We're going on a bit of a holiday break for a couple of weeks here, so our next Learning Lunch won't air until January 8th. It has the title, Set Up Your Practice for a Successful 2014 Meaningful Use Attestation. Keep an eye on your email box on our homepage for other upcoming topics, and thank you again for joining us today.